So, Dr. Henley, I need to tap your brain about an issue that many women find that they have to just deal with, and they don't know how best to, and they want some expert advice, and it is that of cellulite. What causes it? Where does it happen, and why does it happen?
Well, let's first define cellulite. I believe that most women refer to cellulite as the accumulation of fat that's not just the fullness, but the irregularity or the lumpy, bumpy appearance. So there are two components. One is the accumulation of fat, and the other one is its irregular deposition. And then the questions I get from patients, why do I have these thighs and why do I have these things? So there are certain common medical facts that are important. First of all, if there's fat in a woman below the waist, on the hips, and below the waistline, that's medically not so bad because it shows protective ability against heart attacks and hyperlipidemias. So the body distribution of fat below the waist that people always complain has shown to have cardiac protective distribution. And it's only at menopause when there's increase in waist fat that also we see more cardiac disease. Having said that, a lot of women that I see are dissatisfied with the distribution of fat that they have. And I have a sort of a common answer when they ask me why, and my answer is that God doesn't distribute fat according to Cosmo magazine template. Some fat is a storage to get women through childbirth and environmental stresses. So women do have a little bit more fat biologically than men. Now, when it comes to the aesthetic value, if the thighs are too big, there are several medical answers. When there is a maldistribution of fat, and there's more fat in one area than the other, than you would like, then liposculpture or liposuction are very beneficial technologies. Number one, they can remove fat from areas that seem to accumulate even when you look at food. So it can rearrange or change this distribution because liposuction removes the fat cells from given area. So even if you put on weight, that area will not be so susceptible to gaining weight in the future. Now, I happen to have some patents in the field, been doing this for a long time. There are technologies that use mechanically assisted, ultrasonic liposuction. More recently, we have lasers that use minimal incisions that try to attenuate the fat in given areas. But liposuction and its variations are a nice procedure to remove fat from given area. There are other controversial procedures where people inject material to try to kill fat cells. They're a little controversial and they're not approved by the FDA here in the United States, and it's called mesotherapy. I'm not going to talk about something that's controversial. We now have a whole generation of technologies that's exploring to go after fat non-invasively, and that uses ultrasound and radiofrequency energies. The component of cellulite that you're focusing on is also a combination of fat deposit and looseness of the skin that wraps around the fat. So there are skin tightening technologies that use radiofrequency or ultrasound that seem to improve it. There are also deep massage or endermology technology that can smooth some of the irregularities in the fat. But ideally, the combination of liposuction, liposculpture, that it may involve transfer of fat from other areas, and some of those adjunctive technologies like skin contracture, radio frequency or the deep massage may be helpful to improve the appearance of cellulite. But there is nothing that removes it completely, and there's nothing that removes stretch marks completely.
So all of these claims that they have creams with caffeine in them, and if you put them on your legs before you go in the bikini, you'll have no cellulite. Not true?
Well, let's just say there are a number of topical products, and it's a multi-billion-dollar industry where you have $3 worth of cream sold in a $4 bottle for $100 that I'm not going to fight with. But keep in mind that FDA in medicine requires that if we make medical claims that some device or cream or drug works, we have to prove it medically. The lotion and potion industry is not subject to having to prove it. So they can just make whatever claims about Olga's cream and the public will buy it according to the claim and their ability to persuade.
So we should save our money and get lipo.
No, I'm saying you should do what you find works. And if there's a magic cream that can rejuvenate you 20 years and you see the difference, by golly, go for the cream.
Well, that makes perfect sense. But one of the things that I often find is that there's weight fluctuations in people. So sometimes, you know, it's that girl that maybe lost 40 pounds or 30 pounds after she was pregnant, or, you know, it's the rapid. Well, is that something that you work with too?
Well, think about it. Think about skin as being elastic. When a woman goes through a pregnancy, the skin on her tummy gets a little stretched, and sometimes it's not as resilient, and you have some excess skin after several pregnancies. If your weight fluctuates, that thigh skin behaves almost like your tummy skin. Mm-hmm. You stretch it, then you lose it. After a while, few of those fluctuations, you may have parts of the skin that hang. Mm-hmm. So now comes the surgical options and the skin contracture options, and the market is replete with options. But in reality, once the skin is stretched, there is no magic to contract it to a large degree. You may get a subtle contraction with some of the technologies, but if things are hanging, it will involve surgical options.
Well, this has been fantastic. Now I know everything I need to know about cellulite, and I don't have to be so mean to myself in the mirror anymore, because I know why it's there and I get it. So I thank you again for your time.
Well, you can shape the mirror to lie.
Excellent.